So good evening, friends. You are again welcome to the next episode of Kaho webinar, which is on the topic of overview of health informatics. The National Library of Medicine defines health informatics as the interdisciplinary study of the design, development, adoption, and application of the IT-based innovations in healthcare services delivery, management, and planning. And to discuss this very important and I think a fairly complex topic, we could have not asked for anybody better than Dr. Suren Shukla, who is a PhD, an engineer from IIT Kanpur, and MS in Computer Sciences from the Queen's University of Belfast, UK, with over 30 years of experience in consulting, leveraging IT for healthcare automation, healthcare delivery, innovations, and clinical transformation. I have known Suren Shukla for almost 10 years now and can vouch for the kind of intense passion that he has for the subject, and also he will be very, very happy to share his experience on this very important topic. So over to you, Dr. Suren Shukla.
Thank you so much for kind words. Good evening, everybody. I'm so glad to be participating in this webinar, and I have attended many webinars, but this is the time I'm sitting other side of the webinar, and instead of being an audience, I'm going to speak. So, as the topic says, what is actually health informatics is. I will try in about 40 minutes from now talk about a bit what in health informatics is, how it has been influential, how it has helped a few hospitals, and what are the latest technologies, which direction the industry is moving. So it's a discipline at the intersection of information science, that is data collection, data massaging, building the databases, computer sciences, which is the coding and developing the models, and healthcare, the delivery of healthcare, which involves all the processes. Is the interdisciplinary study of the design, development, adoption, and application of IT-based innovations in healthcare service delivery, management, and planning. It deals with the resources, and resources could be the hospital resources, the operation theater, the laboratory, radiology, different devices within the hospital, methods required to optimize the acquisition, how you acquire the data, store the data, retrieve the data, and use of information in health and biomedicine. So the way the application could be, application of health informatics could be defined in many ways, but I have picked up these 5 areas. Translational bioinformatics, which is the development of a storage, analytic and interactive methods to optimize the transformation of increasingly voluminous biomedical data and genomic data into proactive, predictive, preventive, and participatory health. This also involves or includes research on the development of novel techniques for the integration of biological and clinical data and the evolution of clinical informatics methodology to encompass biological observations. The next is clinical research informatics, which is a very important area. Involves the use of informatics in the discovery and management of new knowledge relating to health and disease. Very apt example could be IBM Watson, which has been the discovery of the 30 years data converting into predictive analysis. It includes management of information related to clinical trials and also involves informatics related to secondary research use of clinical data. Clinical trials would not be possible at all unless huge amount of data is analyzed based on the outcomes on the patients. Clinical research informatics and translational bioinformatics are the primary domain related to informatics activities to support translational research. Clinical informatics, I think, is the most appropriate field or application which is being used in the hospital on a day-to-day basis, is the application of informatics and information technology to deliver healthcare services on a day-to-day basis. At times, this has also been referred to as applied clinical informatics, so creating templates, documenting patient history, generating lab results, radiology, analyzing radiology images, all that comes within the clinical informatics. Consumer health informatics is another field which is directly related how the patients use the information, how information could be used by the consumers. So it's the field devoted to informatics from multiple consumer to or patient views. These include patient-focused informatics, health literacy, and consumer education. So take example, today being portals being developed, mHealth being developed, all that where the interaction with the patients is increasing, where health informatics is quite useful. Public health is something which is larger from the federal viewpoint, state viewpoint, where how the malaria program is going on, or dengue program is going on, or child health, maternal health, all that is covered into the public health informatics. Apart from all the diabetes and cancer and all those data analytics, that is covered into the public health informatics. So what it requires an expanded and holistic understanding of healthcare. It requires an understanding of mathematical and computer-based concepts of management. So when we look at data analytics or some information or even MIS, which is based on certain mathematical models, so you create different models and do the analysis based on the models. So it is very helpful. Changing concept related to practice of medicine, how medicine has evolved in last 10 to 15 years, which perhaps would have taken more than 50 years and or more. Improving surveillance and disease and health issues. Improving accuracy of diagnosis, reducing time to diagnosis, improving accuracy and efficiency of treatment, potential for cost savings related to best evidence-based practice. I think this is very important point, because health informatics is not only a tool, it's a strategy for the hospitals to make it a part of the operation, so that business growth as well as the savings are achieved, or outcome-based savings are achieved. So this brings us to the point where we have to debate how health informatics is helping. Perhaps health informatics is helping in many areas, but I have listed down 6 areas where a specialization that combines communications, information technology, and healthcare to improve patient care is the final objective. So 6 ways. One of them is dramatic saving. So saving is, I think, without the saving, hospitals cannot survive. So healthcare is not just expensive, it's wasteful. It's estimated that half of all medical expenditures are squandered on account of repeat procedures. The expenses associated with more traditional methods of sharing information, delays in care, causes a lot of problem. And I think bringing the efficiency into the system brings the dramatic savings. That is the one of the way health informatics helps. Shared knowledge. I think healthcare is called a practice, and the reason why it is called practice is the sharing and continuous learning of the activities or developments in the healthcare. So, and it's because healthcare providers are always learning more and honing their skills. Health informatics provides a way for knowledge about patient disease, therapies, and different kind of the activities that is within the hospital happens. So I think sharing knowledge is one of the area where using the procedures, the processes, using the IT as a tool to bring to capture the data, analyze the data, project the data into different forms where the knowledge can be used is a key area. Patient participation is another very important. The patient, the entire healthcare is for the patient, and patient cannot be isolated. So this health informatics helps the patients to participate in entire journey of the treatment, whether in the form of getting these days mobile health or M-health is one area where you are able to get lab reports or different kind of information advisory services on your hand. So the engagement of the patient is very important, and that's a key area for the health informatics to transform the healthcare delivery. The impersonalization of care. In many of the discussions, I have noticed doctors saying when we involve the informatics or engage into the informatics, the eye-to-eye touch with the patient is lost. That is where sometimes I disagree, but yeah, that's the question comes. The information which is gathered about the patient at different transactions, different point of time, and it could be presented in a, because so much of data, it is very hard or difficult to analyze. So there are tools could be designed which present the data into as meaningful information to the doctor. That's impersonalization of care can happen. Increase coordination between the departments, different departments. If health informatics is not there, I hard to believe how a large hospital will work, because the way information flows right from the registration of the patient to the discharge of the patient without an integrated information flow and coordination between the different departments, I don't think the efficiency in the system will come in. So that's where the health informatics helps. And another is when the improved outcomes. We all design the systems, IT systems, for improvement of the hospital, the services in the hospital. So, for example, when a lab test is done, a lab test is the result is immediately available to the patient or to the doctor. That's one of the outcome. Similarly, when the patient discharge summary is created, it is created in few minutes. based on the whatever transactions happened on the patient during the course of their stay. That's another outcome. So outcome-based results or using the health informatics for better outcomes is one of the objectives. So how it happens? So let's assume hospital as a block diagram where different departments constitute a hospital, and I can assume theoretically these are the departments: so reception, admissions, emergency, pharmacy, stores, inpatient ward, short stay daycare, clinic, radiology, operating room, CSST, billing, finance, diagnostic labs, dietary, medical record. So typically this would be a hospital. It could be a chain of hospital, it could be a small hospital, big hospital. Depending on the size of the hospital, some of the departments may not be available, but generally this is what a hospital is. Now, if I separate these hospitals into different departments, or assume as isolated departments which have to interact with each of the departments for the for providing care to the coordination required between the departments for providing the care to the patient. So these are the different departments. So what these departments will have. So if we look at identity management, perhaps is one of. So identity management, resource scheduling, similarly referral management. These are the service or the solution will be required for managing these services in a hospital. So referral management, ambulatory care, emergency care, inpatient care, day care. So if I don't follow the process, so I can just read it. Inventory control and procurement, one of the module would be required. Operating room, clinical charting, ordering and requests, payer and service contracts, claims management, asset management, sterile supplies, clinical imaging, medical records, information reporting, dietetics, order fulfillment, clinical laboratory. So these are the services required. So for in a coordinated manner or in as an integrated solution. So services required, core hospital information services required for meeting the requirement of a patient. So physician documentation, for example, starting with physician documentation, it will require electronic medical record. It will require computerized physician order entry. It will require evidence-based medicine. So smart technologies, stretchers, beds, smart beds, nurse calls, patient cards, point of care technology, barcoding RFID, voice recognition, handheld devices. So the mobile is one. Today, earlier the PDA was used, but now most people use mobile devices. Radiology packs, cardiology packs, multimodality, advanced imaging. Then devices integration, medical equipment. So lab equipment interface, ICU equipment interface, different modalities interface. Then e-health, which is the patient, it's the portal created. You are able to interact with the patients in outside the hospital, or doctors are able to participate in the discussion outside the hospital. All that. So e-health, medicine may not be immediate need for the hospital, but is at the state level or government level, this is required. and even larger hospitals are helping the people using the telemedicine. Ancillary clinicals like pharmacy, radiology, transcription, lab, biotechnology, genomics, tissue reengineering, bioinformatics, computer-aided diagnostics, computer-aided surgery, robotics. So these are the core hospital information services required. And how these core information services can be delivered is in the form of different modules. So if you look at what is required as an application or a standard application, what kind of modules are required. So registration, starting from registration, problem-based appointment, problem-based appointment, general scheduling, health camps, patient inquiry, kiosk, admission, transfer, discharge, laboratory, imaging, radiology, pharmacy, diet and nutrition, supply chain management module, asset management, billing, BCMA, blood bank, CSSD, OT, linen and laundry, transport module, biomedical waste, MIS, and if I go further a step beyond MIS, analytics, data analytics and data warehouse, and even the predictive analysis, primary care, telemedicine, multidisciplinary care, preventive care, chronic care, allied health, nursing, wellness, family planning, mother and child. So if we look at in totality, these are the modules required as a part, or application needs to have these modules to take care of entire healthcare delivery service. The challenges, there are challenges in the healthcare delivery. Errors happen across the entire patient journey, and and whether health informatics is used or not used, errors will happen. Health informatics helps the hospitals to reduce the errors. And if we look at journey, and at each patient journey, in this process of the patient movement from when he comes in contact with the hospital at the registration desk, where his patient record is created, and after the patient record is created, he moves to the OPD, moves to the OPD consult is created, and he consults the doctor. Doctor advises medications, lab orders, pharmacy, radiology. So and based on the condition, he may advise admission. After the admission, patient may go to surgery or medicine ward. A transfer may happen. Doctors will take care of, or nurses will take care of the patient. Notification, consult happens. Procedures happen. Order sets are given. Clinical templates are generated. And after that, the patient, after the billing and all those things, may be advised for discharge, and discharge summary is created. In this process, errors may happen anywhere. But assume if if health informatics is not used, then the chances of errors are manifold. Now, where adverse drug events originate, so take an example. Errors may happen anywhere in the process of the or entire journey of the patient, right from capturing wrong details at the registration to giving a wrong discharge summary, or making some errors in the discharge summary. But generally, the serious errors happen in prescribing, which is 39% of errors. That's a global standards, global publications. In dispensing, about 11%. In transcribing, 12%. And administering 38% errors happen. And this slide, I have taken this slide, which reflects, take the first figure, order written for 8 units of Lantus insulin, misread as 80 units, which is very common. Sometimes, the writing is not understood. Or in another case, an order for Amaryl 2 mg is misread as 12 mg. Now, if a clinician is using CPOE, it can reduce prescription errors by up to 70%. That is a significant improvement by use of health informatics. And I'm aware a few hospitals are significantly using CPOE. A couple of them are in the NCR itself, which is very good, and their adoption is up to 98%, which helps the helps the hospital to reduce the errors. So, what are the advances in health informatics? Health informatics is all about data. In the entire patient journey, when we design the system, they design the system for transactions, different transactions, and at each transaction stage, we capture the data. So informatics is a scientific, systematic field of study, as Dr. Agarwal told, that deals with the acquiring, storage, retrieval, and processing of medical, biological, and associated data. Information and knowledge for the purpose of problem solving and decision making. So data, capture right data in real time process at the transaction, at the time of action or transaction, and then converting that data into information, extract the right information by proper analysis, intelligence, improve KPIs with actionable insights, and also knowledge, that converting that data into information, intelligence, and then converting into knowledge, a standardized organizational process. So with the use of health informatics, time to time, based on the data information, the processes are standardized in a hospital settings. So use of IT and process improves the efficiency of the hospital, but only process will not help. Process might help 7 to 12% of the efficiency. It may bring improvement 7 to 12%, but IT and process together will maybe bring up to 24%. So the simultaneous application of an enterprise-wide transformation program and a strategic investment, which is about 0 to 4% depending on the size of the hospital, and a strategic investment in appropriate IT applications. And these are global figures also. In India, it could be different. And infrastructure generates up to 6 times minimal investment. So health informatics includes patient engagement, where lifelong medical record is generated. If you're maintaining lifelong record using the paper and non-integrated system is very difficult. So lifelong medical record is generated, e-prescriptions are generated, e-labs, patient can see the lab results, patient education, and mobile health. And I think these days M-Health has been, there's a lot of development happening, both Google and Apple and Microsoft doing so much of research and investment on M-Health, which is creating information, which is helping patients to get a lot of health related data. And if that is integrated with the hospital system, it will help the patient. Clinical workflows, order sets, which is closed loop medication, standard nomenclatures like different standards followed, evidence-based flows, genomics medicine, real-time alerts, medical legal compliances, and artificial intelligence-based flows. That's part of the clinical workflows, and health informatics includes that. Convenience of services, affordability, home health, expert counsel, safety, and instant access of the information are a few key areas where this health informatics helps. It includes policy making, preventive health, disease surveillance, chronic care, drug policy, device policy, machine learning, and research. It also includes operational efficiencies. So staffing, it helps in the control of inventory. It helps in the equipment. Take example of interfaces, different kind of interfaces, equipment providing data directly to the system based on which decisions are taken. Turnaround times, wait times, IoT devices or Internet of Things. You can connect any IoT devices these days with the system, both during the care and even after the patient is gone or patient is discharged. You can provide a home care, revenue cycle management. So health informatics can bring there are different stages of health informatics. As per HIMSS, there are 7 stages of health informatics where different levels of automation define the stage. So stage 0 is when all 3 ancillaries not installed. But level 1 is ancillaries like lab, radiology, pharmacy, PACS, all installed or automated. The stage 2 is where CDR, interoperability, basic security is installed. Then stage 3 is nursing and allied health documentation, EMAR, role-based security. So all that is now different stages involve different levels of automation. So stage 7, which quite a few hospitals in India have reached to the stage 7, and I'm aware, I think Apollo Banjara Hill and Max here in Delhi, Saket Max, are HIMSS 7 stage, where complete EMR, external HIE, data analytics, governance, disaster recovery, privacy and security is involved. Or that level of automation has happened. So what are the benefits of health informatics? This is some of the publications published by HIMSS, realizing the benefits of health informatics. So satisfaction, treatment, clinical, electronic information data, prevention, patient education, and savings. These are the 5 areas. Health IT creates 5 kinds of value or benefit to patients, healthcare providers, and communities. So satisfaction being the patient satisfaction is the first category, where different data suggests that 118% increase in patient satisfaction with the health informatics, different levels of health informatics, and 90% increase in staff retention due to satisfaction. Treatment clinical, there's a 50% decrease in 30-day readmission rate. Readmission is a critical, area where patient readmission causes expense burden both on the hospital and the patient. So 50% decrease in 30-day readmission rate, 20% physician time. Electronic information data, that is 500,000 annual decrease in claims denials. I think this is a very important. If data is captured, a health informatics is implemented and data is captured in a proper format, then denials of the claims by the payers is significantly reduced. Prevention and patient education, 96% compliance rate for patient and medication scans, 190% increase in immunizations, and 150% increase in patient meetings, meeting diabetes management metrics. That is the achievement on implementation of health informatics. Savings, which is most important for any hospital, and with the use of health informatics, 9.7 million saving due to elimination of transcription services. The clinicians use the system for documentation and CPOE. 3.1 million reduced length of patient stays, and total return on investment was 17.7 million in one of the case. So how it helps? Improves clinician hospital productivity. Continued use of paper records is unproductive, and that's where health informatics helps. 38% time is spent writing chart notes by clinicians. 35% of hospital costs are spent on patient and provider communication activities. 30% time medical records missing when needed. So simply by organizing information flow sheets, accelerated retrieval of needed data at least 4 times. I have taken one slide here just to give an example. Use of a structured, so as a part of the health informatics, use of a structured order sets improve care outcomes. It is evidence-based, quick ordering, so you can order, all the tests which generally you order for particular case, you can order in one go instead of ordering or writing separately. So quick ordering, standardized care, faster turnaround, and safety checklist, because you will have the safety inbuilt when ordering, all contraindications and allergies, all that will be taken care. So another health informatics which is uses BCMA, which reduces administration errors significantly, or I'll say 100%. Right medication, right dose, right route, right patient, right provider, and right time. So some of the hospitals started using BCMA, and it is significantly improving the. It is significant.
Tell that BCMA is barcode.
Okay. So BCMA is barcoded medicine administration. So if you look at the picture, this is a barcode. This is a barcode, and this is a barcode reader which reads, and it has all the information fed. So it reads the medication is given to the right patient by right provider, and right dose is given. All that is built in. So chances of errors are almost zero. Clinical decision support system. If you look at the medicine field, is, I have always heard from the people. I did my engineering and finished it, but I heard from people, the doctors have to read and read and read. So 20,000 biomedical journals, 500,000 index in PubMed annually, 150,000 articles per month. How much a person can read? That's where, to keep update this, the IT system or health informatics is collating the data and providing you information at right time. So you get the correct information and correct process, correct method of treatment, upgraded method of treatment on fingertips, and that system throws. So health informatics significantly, one of the example I gave, the BCMA. So health informatics significantly improves my pharmacy. It helps in pharmacy, my hospital. So I as a patient, lifelong patient record. If I have a patient, I can have my pharmacy, my hospital, my clinic, my lab, my doctor, my employer, my care team, different policymakers, patients like me, and my payer, insurance. So all industry players have access to the same information in real time. Better coordination of care. So one data is available to everybody. Tighter control on cost, greater patient engagement, enhanced safety, improved outcomes, personalized medicine, and better policy decision by policymakers. So like my lab, convenience, turnaround times, lab results are through the integration immediately available. Similarly, radiology results are available immediately. Images are available to view even at the remote area, which is using the PAC system. So here I tried to give one case how health informatics has helped. This is a case of VA hospital, Veteran Affairs hospitals, and compared with some of the best hospitals. So consistent use of health informatics resulted in a large hospital system ranked #1 for 8 consecutive years in a row. And how? Because 18,500 clinicians who are working with VA all have used 100% CPOE. CPOE or computerized provider or order entry is the key. If you are using the CPOE, you are reducing errors at different stages and bringing efficiency into the system. #1, patient satisfaction, and 33% of all hospital-based research papers published each year were from VA. That's the kind of improvement or significant improvement has been brought by health informatics.
Last 5 minutes, Suren.
Sure, I will rush through. So health informatics has challenges: doctor-patient interaction, out-of-date guidelines, template fixation, incomplete data, oversimplification, reduced privacy, additional time. So these are few areas where the health informatics has challenges, and slowly the improvements happening in these areas. Doctor-patient interaction has improved significantly now as compared to 10 years before. Now, so another, I'll take another 4-5 minutes. The technology trends. While healthcare has historically been slow to adopt technology compared to other industries, the industry is about to witness significant changes over the next several years. Leading companies are already redefining themselves with digital transformation applied to their main functional areas with customer-centric approach. So the 6 technology trends to watch in 2019 is telemedicine, which is not new, but it is in the current form is disruptive, and I see most of the government tenders coming in the telemedicine area this time. So telemedicine with integrated healthcare IoT devices, which is actually perhaps helping telemedicine. This solution integrates video presence, integration of IoT healthcare devices and data management platform, allowing last mile healthcare delivery where presence of physicians is limited. This has received national recognition and many governments are adopting. One such example is Government of Maharashtra for its Smart Villages program of 1,000 villages. Artificial intelligence, another technology trends to watch. Artificial intelligence is poised to become a transformational force in healthcare. Artificial intelligence is of great importance in healthcare. It can collect data over time, access data stored in other computers, and go over data written on the internet, online books and research notes in a matter of seconds, and make an informed decision based on the data it's been over. So it helps the clinicians to fetch the data, to take decision. It helps different protocols to be followed. It helps take an example of I can take example of Watson, where Watson helps to identify the cancer in the treatment of the cancer. Internet of Things, that's a buzzword these days. The network of physical devices, vehicles, home appliances, and other items embedded with electronic software. Sensors. So sensor is the main technology here, which helps all the people, all the devices to be connected and provide data into the system. One example I could give quickly is connecting your glucometer or your blood pressure or temperature into your mobile, and then transferring the data to the main system, even to your GP. Data-driven healthcare. For years, doctors and hospitals around the world have collected information on various diseases, their diagnosis and treatments for research. Most of this information is stored within individual databases. Today, healthcare has adopted big data analytics to harness the unique ability to link patient information from vast databases in a way where the privacy of the patient is secured. I gave example of IBM Watson, but another example could be a Switzerland-based company having studied some 200,000 cases of blood sample and collected the data, and based on that now developed the algorithm which can read the blood report and predict what kind of ailments a patient will have. So that's another area. So technological advances of the recent years have led to the dramatic growth in the amount of medical and health data gathered about individuals. Healthcare professionals use this big data to make the diagnosis quicker and easier. Data analysis can also improve the efficiency within a healthcare organization, and insurance companies can use big data. So I think the big data is another area where the data collected into the system over the years can be analyzed and converted into meaningful information. Blockchain is something which is I have recently implemented. Actually, blockchain in Rajasthan government has implemented EHR on blockchain, and it is being used currently. What it does, it creates non-editable multiple copies can be accessed by users across spread across based on the access rights can use, and this creates a layer of information. So blockchain currently is very slow in perhaps adoption, but with time, blockchain will help the healthcare industry significantly, because it can replace the interoperability or HIE concept. So I think that with this, I would like to conclude here that appropriate as a part of the health informatics, selection of appropriate application, looking at 5 to 10 years time is important. Reduced investment in infrastructure. Don't try to invest in the infrastructure. Go for the cloud-based applications, and and cloud is safe. Cloud is safer than having the data in premises, because when you have data on premise, you have given access to few people. Those people may plan to leave, and they may share the information. But when it is on cloud, it is all happening through the controlled processes, and nobody will have access to the data. And the third point I would like to make is continuous upgrade and training is required for a meaningful or significant health informatics. Thank you.
So thank you, Suren, for a very exhaustive and a very beautiful presentation that you gave about this, I would say, a topic which a number of us understand, but we understand it in patches. I think you have helped us in collating all the different kind of aspects to understand this whole terminology of healthcare informatics. So with that, we are coming to the end of this. However, there will be, I'm sure, questions, some of the questions which are there, which probably are outside the scope of this, like there is one of the attendees who has asked that are there any support or incentive from the government which can be used to motivate change? I mean, so he says he is a resident medical officer at a government medical college blood bank, and he had a hard time convincing the department to adopt the health informatics. So what I will say that maybe some of these questions and other questions is challenges for small healthcare organization. You see, challenges are there for the simple reason that, like this particular presentation has been done for us to understand, first of all, the overview of the healthcare informatics. People are understanding some part of the healthcare informatics and want to only implement that what they are comfortable with. And therefore, to make an informed consent, this is a very, very small and beginning of trying to acquire that knowledge. I think what I will request is for the listeners today that you can post your questions, and Suren Shukla will be very happy to answer. He will be in touch with you to give you one-to-one reply to your queries. And so with that, I'm sure that there are people who have said that it's a very beautiful presentation connecting all the dots, and thanks for the exhaustive presentation. So thank you, listeners, who have tried to articulate, in fact, whatever I wanted to say, they have said it. So thank you, Suren. And I think with this, we end this session today. Thank you so much.
Thank you so much. Thank you.